Learning about diabetes is very important because it helps us to take charge of our own problem. Let us begin by understanding why does diabetes really occur. For this, we have to know what is the sequence of events that happen when we eat food. Whenever we eat food, the food that is absorbed, a part of that food is broken down as glucose into the body. Now, when we eat food, the glucose levels tend to go up in the blood, and that tends to trigger off a host of reactions by which the entire lot of sugar is converted into a stored form. This helps us to keep the sugars in a narrow bandwidth of control. Now, the sugar that enters into the bloodstream tends to stimulate the insulin from the pancreas, and this pancreas is primarily responsible for helping the glucose to go into the stores of the body that is present into the muscles, the liver, the fat tissue of the body. Now, whenever we are not eating food and that is in the fasting state, a part of these stores are mobilized, and that's how we bring the sugars back into the blood, and this is done by the glucagon of the body. So please try and understand that the sugar stays in a very narrow bandwidth which is kind of recognized as normal for the body. Now, whenever we have blood sugars, that is diabetes, there is a mismatch of this regulatory mechanism where the sugars tend to be high and the insulin is either lacking in the body or is not being effective to transfer this glucose into the stored sites. Now, when you have diabetes, there are certain symptoms that you tend to develop which makes you understand that you have diabetes. A lot of people may not have any symptoms, and that's how they get detected very late. But a lot of people also get symptoms. Common symptoms are that they tend to urinate more often, they feel extremely thirsty, they may lose weight, they may feel extremely tired or fatigued, or they may be prone for infections or delayed wound healing. All this tends to draw your attention, and then you go and check your sugars and you find that you have diabetes. Diabetes are primarily of three types. Type 1, which is commonly seen in childhood, type 2, which is seen in adulthood, and the third type is gestational diabetes, which is seen in pregnant ladies. How do we differentiate each of these types? Type 1 is usually an immune-mediated type, where the immune mechanism of the body tends to destroy the cells which make the insulin, and as a result of it, there is an absolute lack of insulin in the body. Now, people who suffer from type 1 diabetes require insulin injections right from the time that they are detected to have diabetes. Type 2 diabetes, there is still some preservation of the cells, so there is an insulin production that happens in the body. Now, when you have high sugars, we give them tablets, we try to augment the secretion of the insulin from the body and try and control the sugars. Now, if that doesn't happen, you find that there is a lot of lack of insulin, then ultimately even this type may require insulin at a later point of time. The third type, which is gestational diabetes, the lady becomes pregnant, she has normal sugars. During the course of pregnancy, the sugars tend to climb up. We need to control this with insulin, and once the pregnancy is over, the sugars come back to normal. Very often, at least 1/3 of these ladies in the later point of time may tend to become diabetic. So there has to be a constant surveillance that tends to take place where a lady is continuously screening for sugars, maybe once in 6 months or once in a year. Now, how do we really diagnose diabetes? There are certain set criteria that we accept for diagnosis, and we generally do two main tests, that is the blood sugar estimation and the HbA1c. In a normal individual, your fasting sugar should be less than 100 and your post-meal sugar should be less than 140. If you have a fasting sugar between 100 to 125, it is termed as impaired fasting sugar, which is a kind of pre-diabetes. And if your post-meal sugar is anywhere between 140 to 199, then this is termed as impaired glucose tolerance, which is again a form of pre-diabetes. If you have a fasting sugar which is more than 126, or if your post-meal sugars are more than 200, then you have overt diabetes. Going by the HbA1c criteria, if you have an HbA1c of less than 5.7, it is normal. If you have anywhere between 5.7 to 6.4, it is pre-diabetes, and anywhere more than 6.5, it is termed as overt diabetes. I hope you found this video informative. Stay tuned to our channel Do like our videos and please offer comments and suggestions.